Dr. Nathan with Back to RX Physical Therapy. We're going to go over a grouping of exercises I call them the low back Tylenol exercises. Just for something for you to be able to do once your back is a little achy, a little sore, hurting a little bit, that you're going to be able to do. That's not any sort of medication, but that's movement predicated, so you can learn how to control your pelvis a little bit more and be able to help improve your pain. So first one that we're going to do here is we're going to do some pelvic rocking. So we're going to be putting our fingers up on these bones, which is called our ASIS, right here up on the top of our pelvis. And we're just going to work on rocking our pelvis backwards into a posterior tilt and to an anterior tilt. Some people might talk about lifting your back, arching your back, and pressing it flat. I want you to think more about being able to control your pelvis while you're doing this. So if we're doing this correctly, we should feel those bones underneath our fingers roll backwards and kind of up towards us as we do this, and then go back and disappear from underneath our fingers. We don't want to lift our rear end up off the ground on this one. We just want to be rocking back and forth, just with a pain-free range of motion, maybe a little bit of discomfort, and then backing off and just moving back and forth. We're working on moving our spine into flexion and extension with this one. So the next grouping of these exercises that I have is called lower trunk rotations. We're just going to rock our knees from side to side, nice and easy. And what we're trying to do is, I don't want my knees driving this, I want my pelvis driving this, and this is being controlled by my abdominals. I'm allowing this to come down, and I'm kind of using my obliques to pull myself back and forth, keeping my shoulders down and on the ground. Okay. The last one that we're going to do is just some marching with an abdominal stabilization. So we just worked on being able to posterior tilt and utilize our abdominals to do that. So what we're going to do now is we're going to be feeling onto those bones. I'm going to come up as far as we feel like we can without our bottom lifting up off the ground, and then relax. Do half of that, so 50%, and then we're going to relax again, and then we're going to go half of that, so 25%, and we're going to hold that. And we're going to be using our abdominals, and we should feel them contracting a little bit, but I should be able to have a normal conversation with this. I just want to feel like these are steady. And from here, what we're going to do is we're just going to work on lifting one knee up in the air and coming back down. And as I'm doing this, we're trying to feel onto these bones again. And before, we were actually wanting them to move up and down. Now, at that 25%, we want them to stay stable. As I lift my foot up in the air, I shouldn't feel this hip bone moving back and forth. And it's going to be both, but we're thinking more about just being able to keep our pelvis in line with that by using our abdominals to hold on to that. We can switch to the other side. Then once we feel comfortable with it and we're not letting them move, we can alternate from side to side, being able to carry a normal conversation with this as we're stabilizing our abdominals. Something good to be able to do if you're having some stiffness in your back, having some achiness in your back and your pain, to help kind of desensitize that area. So if you like this video, go ahead and click subscribe.